going to give a few more seconds for everyone to join our roster, and then we will get started shortly. I think we're going to go ahead and get started. And thank you all for being here. We're very excited to present this information to you. We'll go ahead and introduce our participants shortly, but I do want to let you know that we are going to give a lot of time for question and answer at the end of this. So please sit tight and we will provide you the instructions as we go along. So next slide. I am one of your presenters today. My name is Joelle Simpson. I am the Medical Director for Emergency Preparedness at Children's National here in Washington, D.C. And I'm excited to present to you this opportunity for the Disaster Networking Collaborative that is being sponsored by the Pediatric Pandemic Network, which is funded by the Health Resources and Services Administration, and is a nationally funded grant to help us sort of do better for kids, especially in children's hospitals. My co-presenters, Dr. Kazani and Dr. Eisenberg, will present sort of their background when they are presenting their slides, and so you will meet them in a few minutes. Next slide. My role today is to give you a little bit of the background of how the Disaster Networking Collaborative came to be, and hopefully to get you very excited about it, because we are, at the end of this, going to welcome you all to that initiative. In terms of the start of all of this work, we are really proud to present this roadmap of work that's being done largely by the other funded program by the Health Resources and Services Administration, the Emergency Medical Services for Children's program, that has been doing a lot of work around everyday readiness for kids. Many of you are probably familiar with that work, where there has been discussions of, how are all of our hospitals, children's hospitals, community hospitals, general hospitals, how are we all preparing for kids for everyday emergencies, both at the hospital level and at the pre-hospital level. You can see here that the work that has been done since the 1980s include having the Data Analysis Resource Center, having state partnership programs, and now our recent innovation of having the Pediatric Pandemic Network funded to sort of push the bar, not just for everyday readiness, but also with a heavy emphasis on disaster readiness for kids. Next slide. Oh, I think we're going, yes. So the PPN has very specific goals, part of our charter from our funders in the federal government. And number one is to increase children's hospitals partnerships with all levels of preparedness, whether that be local, state, regional, or national. We want to collaborate with our community partners, include the work that's been done by Everyday Readiness, and continue to advance that in the context of our everyday crises as well as our larger global health threats. Increase the capability of systems such as telemedicine, as we saw that emerge even more so during the pandemic, and then to accelerate real-time dissemination of research-informed pediatric care. Next slide. Our core activities are around these 5 goals, which is providing training and support tools, sharing best practices, encouraging collaboration, using that systems-based approach, and really promoting equity, inclusion, and cultural relevance. This is very similar to what we hope to accomplish within the Disaster Networking Collaborative, which you'll hear more about shortly. Next slide. I want to introduce my colleague, Laura Aird, who's going to talk to you a little bit about housekeeping for today's webinar.
Hello, everyone. I'm Laura Aird, and I'm a Senior Project Manager for the PPN Quality Improvement Service Corps, which oversees the Quality Improvement Collaboratives, including this one, the Disaster Networking Collaborative. Please feel free to introduce yourself in the chat box. If you are a nursing professional, CE is available for this session and will be throughout the collaborative. We also have approval to offer MOC Part 4 credits for physicians, beginning with the collaborative sessions in September. So put your first and last name in the chat box. If you're a nurse, mention that you're an RN or a nurse, and stay with us until the end of the webinar, where you will be able to click a link or scan a QR code to take the steps to receive your credit for this presentation. Again, questions can go into the Q&A box throughout the session. The faculty will answer those along the way, and then near the end, we'll be able to raise any issues that require some discussion. This webinar, as you can tell, is being recorded. The recording and the slides will be posted online for your viewing afterwards. We do have a second webinar like this one that will be held in August for anyone who is still interested in registering and has questions, or anyone who has then registered but missed the first one and wants the information. Next slide, please. These are the objectives for today's talk. You're going to hear a little bit about the current state of disaster preparedness and response for children. We're going to talk about the impact of COVID and Tripledemic, the Tripledemic had on children's hospitals, and the need to prepare now for the next event. I'm pretty sure you're all aware of that. And definitely we're going to talk about the DNC, give you some specifics, and tell you about next steps so you can get the full participation of this incredible activity. Next slide, please. I'd like to turn it over to my colleague and friend, Dr. Brent Kasny.
Hey, everybody, and welcome. My name is Brent Kasny. I am a pediatric emergency medicine physician at Texas Children's Hospital in Houston, Texas. I'm also the medical director of emergency management here. In that capacity and in my capacity as the co-lead of the disaster management domain, I'd like to talk to you about why we think this is an important collaborative and kind of a little bit about my personal experience in becoming the medical director of emergency management here at Texas Children's, and what that means and the kind of interfaces that I found fruitful in my career, not just on a local and regional level, but also nationally with other leaders similar to myself in children's hospitals across the country. It's no surprise or shock to anybody that natural disasters are increasing, not just in their frequency, but in their intensity. And this just highlights the need for the work of the Disaster Networking Collaborative, and beyond that to future collaboratives that we intend to engage you all with. Next slide. But when it comes to children, oftentimes children are thought of more as an afterthought as opposed to a priority. We know that children make up 25% of the population and present unique healthcare needs and challenges during disasters. You know, we oftentimes, I think, paint ourselves as pediatric disaster medicine experts, but I urge anybody to try to do anything disaster related with a group of 5-year-olds. And if you can do it with 5-year-olds, you can probably do it with 25-year-olds. So maybe we're really disaster medicine experts. In 2010, the AAP actually conducted an opinion poll trying to see what members of our society and what folks in this country thought about the prioritization of children in disaster planning. And what they really felt was that children should be given higher priority and their needs should be prioritized over those of adults. Next slide. But instead, what we're seeing and what was presented in 2010 by the National Commission on Children in Disasters is that really the reverse seems to be true, that priority is given to adults and that there are maintained deficiencies in really any functional aspect of pediatric disaster preparedness. And while this was done some time ago, the National Advisory Committee on Children in Disasters really still sees the same shortfalls existing throughout our country. Children are more often thought of an afterthought as opposed to a priority, and thinking about them as vulnerable populations or at-risk populations really puts them in that appendix at the end of the book instead of into the true content of the book when thinking about these sort of issues. Next slide. More recently, the National Pediatric Readiness Project just released its data from its 2021 survey of all emergency departments across the country. And what we see is comparing the data from 2013 to 2021, we see that still what we're seeing is pediatric considerations in disaster plans remains one of the lowest scoring measures in the entire project and in the entire survey. Even among high volume pediatric centers with more than 10,000 pediatric visits a year, only 83% of them were able to say yes to the very simple question of, are children included in your disaster plans? When we look at those hospitals that see less than 10,000 pediatric visits a year, that number drops precipitously, and overall, the number was, again, the lowest scoring measure at 47.5%. There were a number of additional questions related to pediatric disaster readiness that included things like including children and youth in special healthcare needs in your planning, thinking about specific decon plans for children, and a variety of other things, all of which were even less than 47.5%. So again, we have a lot of ground to cover to push that needle to improve our degree of disaster preparedness for kids. Next slide. But what we see is that children's hospitals across our country are viewed as a valuable resource for the communities that they serve. When we look at community hospitals, general emergency departments, where we know a bulk of the care for children exists in this country, over 80% of children that present to an emergency department, we know present to a non-children's hospital for care. They see that children's hospital as a resource. And oftentimes in their disaster planning, who they're really including as far as including children is saying, connect with the children's hospital. But how are we engaging with them in a meaningful and impactful way? Are we reaching out to them and creating that framework of connection to really be able to empower them to do a better job, as well as ourselves as children's hospitals? And how are we connecting with each other as well throughout the country? Next slide. Now, this was all really highlighted, and I think came to a point when you look at the Tripledemic in the winter of 2022 to 2023. This really highlighted the fragile state of children's hospitals. You know, we're all too familiar with being on constant census alerts from an acute care and critical care perspective. And we know that this is a multifactorial problem that includes the reduction of pediatric beds in non-freestanding children's hospitals and in non-children's hospitals, and some of the challenges related to the specialized care that sometimes children require, especially in that critical care situation. But who is there to help, and who should we be engaging as children's hospitals to try to improve not just our own degree of preparedness, but also connect with other folks in our regions as well? Next slide. Now, we see as one of the key groups to partner with in this, because a lot of these people are sitting at the table in this space, are healthcare coalitions. But what is a healthcare coalition? As you can see on this graphic here, healthcare coalitions are encompassing of hospitals, public health departments, EMS, emergency management agencies, really the gamut of folks that would be involved in responding to any sort of disaster event would be having a seat at the table in a formal capacity in this sort of a setting. So we see that as that interface and that connectivity between children's hospitals and healthcare coalitions being really key to this work. Next slide. But how can we do better? Not just physicians, but nursing partners and other clinicians, emergency managers, et cetera, that work at children's hospitals. How can we do a better job of including that slant of pediatrics, those pediatric considerations into the work that we do? And I think there's a variety of levels at which we can do this. And many of these things are things that I've done through my career. And I'll give you a little bit of a conversation about my story and the journey that I've been on, as I think it lays some of the foundation, highlights some of the importance of what we hope to achieve through the Disaster Networking Collaborative. At the hospital level, it's really looking at, is there somebody with pediatric expertise, whether that be a physician or a nurse or somebody else that works in your facility that has some sort of role at the hospital level to engage and interact with emergency management in a meaningful way, whether that's being a member of an emergency management multidisciplinary committee at the hospital or having some sort of formal title such as medical director of emergency management. At the regional level, it's looking at that partner that we just highlighted, the healthcare coalition, and saying, do those healthcare coalitions embed in their organizational structure pediatrics? Is there somebody from your children's hospital that connects with that healthcare coalition and builds those relationships that we know will be necessary to have in a disaster response? And at the state level, it's really finding those public health entities, whether it's your State Department of Health, State Department of Emergency Management, and building that network and that connection. But it doesn't just stop there. It continues across the whole country, really leading folks like myself and Joelle that do this job every day to have our network of colleagues across the country that we can lean on in meaningful ways when we're dealing with a local crisis or a national crisis like the pandemic. Next slide. So a little bit about myself and how I became involved in this work and the connections that I've made and the networking that I've done. As an intern, I was involved in the evacuation of Tulane Hospital in downtown New Orleans. I was a pediatric intern at Tulane, and that really ignited my interest in pediatric disaster medicine and preparedness. I proceeded on to fellowship at the University of Utah in Salt Lake City, where I really tried to soak up anything I could find disaster related, any trainings, offerings, webinars, in-person courses, what have you, and was recruited back to Texas Children's to try to develop this sort of a role, to try to develop some sort of medical leadership, clinical leadership in emergency management. The next picture shows a mid-construction sim as we were building our special isolation unit, our biocontainment unit during the Ebola crisis in 2014, where I was really involved because of that skill set that I had related to operationalizing of plans and PPE, but really still didn't have that formal position. And it really took, in the next two pictures, you see a picture from our incident command during Hurricane Harvey. In the bottom left-hand corner, a picture of the flooding in the Texas Medical Center after Hurricane Harvey. It really took Hurricane Harvey to say, we should probably have a physician that's leading some of these efforts and partnering closely with our emergency management team. Somebody that has some degree of background and interest in disaster medicine, but also understands the clinical operations. From there, we've got Winter Storm Uri and all sorts of disasters that I've been involved in the response to at Texas Children's. And that's really led to a variety of partnerships, including sitting on a state level on a senior advisory committee for the state of Texas, and really forming those partnerships with public health and other entities. Next slide. In a different way of looking at it, I've been involved with EMS for Children, the state partnership grant here in Texas. I've been involved in our regional healthcare coalition and serve on the executive committee of that and on the board of directors of the representative from Texas Children's. SETRAC, or the Southeast Texas Regional Advisory Council, is my local healthcare coalition. Was fortunate enough when the EMS for Children Innovation and Improvement Center was formed to really serve the role of director and now co-director of the disaster domain for that. When Region 5 for Kids was in their first year of funding as one of the Administration for Strategic Preparedness and Responses, federally funded pediatric disaster care centers of excellence, worked with them as they were getting going and worked specifically on some quality improvement projects. And then most recently, the Pediatric Pandemic Network and the Gulf 7 Pediatric Disaster Network, the third pediatric disaster care center of excellence, housed here at Texas Children's, but serving the Gulf Coast and Puerto Rico, and where I serve as the principal investigator for that grant. So again, these are just two ways, one in pictures and one in logos of a variety of groups that I've had the pleasure of working with, that shows and highlights the networking and connection that can happen when someone gets involved and takes a step in the direction of not just connecting with their local emergency management at a hospital level, but also connecting with the amazing group of folks that serve in similar roles across the country. Thank you.
All right, thank you, Brent. My name is Jonathan Eisenberg. I am a pediatric emergency medicine physician at UT Del Austin and part of their faculty, and I am the co-lead of the QI domain for the PPN. So just to kind of keep going with what Joelle and Brent have already sort of brought up is kind of leading to this disaster networking collaborative. What is it? Why should you join? And what can you gain from it? So we came up with this DNC to improve pediatric disaster management across U.S. children's hospitals. There are a number of QI collaboratives and groups working on similar or parallel ideas in different manners throughout the country. But I really want this group to look at the whole being greater than the sum of its parts, as well as building on a single institution and networking out. One of our PIs used the term leading from behind, and that terminology really stuck with me because I think that really encapsulates what we're trying to do with this group, which is build a very strong infrastructure network amongst all of the children's hospitals, but we don't need to be in front of the camera. We need to be advising the groups that are in front of the camera. So this group will have multiple foci, which we'll be reviewing. And our overarching goal is both at a micro and a macro level. We're trying to ensure that we are prepared as a singular hospital system, a group of hospital systems, a region, and as a country. The way we're going to be going about this collaborative is we're going to be having webinars with discussions by subject matter experts throughout the country, directing information, excuse me, initially on capacity building and operational infrastructure, and then slowly branching out to specific disaster areas of high utility as we move closer to our next collaborative, which I'll discuss at the end of my talk. We want to ensure that the information being transmitted is actionable, and that we are working from a solid base that everyone can launch off of. So that kind of moves to that arrow to the foundational content. These were topics that we discussed at length amongst many folks during our pre-work sessions. So the first is roles and responsibilities. We want to make sure that everyone can formulate a consistent and standardized idea of who should be involved in this disaster planning and what their respective roles entail. This involves team modeling, expectations, training, and education. The next one, number 2, is C-suite engagement. And this is becoming bigger and bigger. We want to show our value of work, why it is already being done, and the planning that goes into ensuring readiness at all times. We're going to use broad collaboration and data tools to show this. And we should be able to prove that by housing a disaster team, we're making fiscal sense, because that is what the C-suite mostly responds to, as well as serving as a negotiating tool for those attempting to gain FTE or a title. And then the third is engaging in the EM landscape. Our goal is to either start the conversation for those newer to the field with your local disaster partners, or if you have a longstanding relationship, to engage further and take on a leadership liaison role for that children's hospital, whether that's on a, again, local or regional level. And we understand that everyone is at a different stage. The aim is to understand what the children's hospital's role is amongst the many other players in this field. So if we could just go to the next slide. So I just want to highlight our website. It is full of information. A lot of the things that I'm talking about now are highlighted in much greater depth, in granular detail on our website. And we will have a link in the chat box so that you can bookmark it and take a look at it. Some of the things I want to highlight on that, amongst our foundational content, we also have talking points to help you prepare for your group to reach out to the C-suite or your hospital leaders. And then we also have suggestions for infrastructure and roles and responsibilities that were built out by our multiple groups with a consensus data. Okay, next slide. So this is what we envision as sort of the EM landscape in a triangular fashion, with the bottom being our expectations, and then as we move up, truly climbing the station to assume a leadership role. And the goal of this collaborative is really to capture you where you are within this pyramid, and then move up towards the leadership position within your region. Okay, next slide. And because this is a QI domain and a QI project, I just want to highlight a little bit about QI improvement. No one from this project is expected to have a QI background. We don't expect you to come up with posters and projects. What we're really trying to highlight is the manner in which we are going about this. So QI transformation in healthcare is generally a very efficient way to enact change. We found that it takes approximately 3 to 5 years instead of 15 years to enact that change. And through thoughtful planning, conducting drills and exercises, and PDSA cycles, we can promote the health and resiliency of the organization in the face of a crisis. So I want to reiterate, no QI expertise or experience is necessary. I will say creating a network will allow for mentorship and training of fellows and junior faculty. And as someone who is junior faculty, I've already found the mentorship through the PPN and forming this group to be very transformative. Okay, next slide. So just how does a QI collaborative form? This circle is a great illustration of what we've been doing thus far, who we've reached out to, and how we can move forward. So we have chosen the topics, selected design, we have engaged with our teams and pre-work, and now we're at about the, call it 5 o'clock angle to start our collaborative learning sessions. So very exciting. We are using the IHI model, which I have not included a slide, so I don't want to give anyone any past trauma. But we are using that to accelerate change and for use as our evidence model. And there was another quote about QI that really rang true for us, which was, all improvement requires making a change, but not all changes lead to improvement. So as champions for the DNC, we encourage each team to bring about change, but we're not trying to be prescriptive with how that change comes about. Okay, next slide. So why should you join the DNC? Well, I think first and foremost, we're trying to enable as much engagement as possible with your children's hospital to improve pediatric disaster planning. We're trying to strengthen the infrastructure for preparedness. And again, this is from a local, regional, state, federal level. So at all levels, we're trying to strengthen that infrastructure. We are trying to assess the gaps. You will get very short surveys that are looking at sort of the environmental scan for your local hospital and using the QI approach to just create a little bit of benchmarking data. And then for you will be networking and learning from experts. I think if this call is any attestation of that, we have 2 of the country's leaders on disaster preparedness with Joel Simpson and Brent Kasny. You will be getting lectures from subject matter experts throughout the country. And it is rather impressive, the list of folks who are on the PPN and will be performing some of the lecturing duties on the webinars. And then number 5, preparing for the future. There's an opportunity for teams within the DNC to join the Disaster Response Network Collaborative. This is something that will likely take place in 12 to 14 months after our initial DNC work has laid the infrastructure down. The DRC will then roll out to give more granular disaster-specific training. I just want to reiterate that we will be getting MOC Part 4 and CNE credits, and this is a free and very easy to join project. So I would encourage everyone to do so. If we go to the next slide, the registration is very easy. There is a link on the website, and I believe you will receive a link by coming to this. So essentially, the goal is you will form a multidisciplinary team, and this can be clinical plus non-clinical. We want emergency managers working with physicians and nurses and anyone else who would like to join. You don't need to be the head emergency manager for your hospital, but we do want people who are engaged and interested. So that's step 1. Step 2, there is a letter of commitment, and this speaks to, and we'll show it in just a second, speaks to the broaching of the conversation with the C-suite. It is optional, but it does give good talking points. And I think it really does offer a nice launching point if you haven't had that conversation prior, to have a conversation with either your C-suite, your division chair, your department chair, or someone in a CMO role. 3, we will ask that somebody kind of take on the team leader role, mostly just for registering and communication. And then for each team member, we'll complete a brief intake survey again, just so we can get a little bit of information as to who is on the team. So if we go to the next slide. So this very small picture just shows, and this will be sent out, the letter of commitment. And again, this is optional, but I think it's important to make sure that we are moving with purpose. And part of that purpose is gaining leadership support. We're confirming the team leader role, and then opportunities to learn from leaders already working in disaster management. So again, engaging facilities, security, public relations, communications. Okay, next slide. And this is a calendar of events. The 2 dates in red are the webinars. So we have one today, and then there will be one in August. So if any of your colleagues or friends miss this one, you can direct them to that date in August. And then the blue are our dates being held for webinars. And they are going to be the second Tuesday of each month. They will run for 90 minutes with time for learning, engagement, and questions. So that is what I have so far. I'm going to turn it over to Joelle to moderate for questions.
Thank you, Johnny and Brent. That was awesome. We will have we will put the slide up for those of you that want to get the information for the CNE credits. But in the meantime, there has been one question that came through in the chat, and maybe I might direct it first to Dr. Kazany. There was a question about commenting on training programs such as the FEMA training program, including the one in Anniston, Alabama, that helps us learn more about disaster preparedness and leadership. How does that build into maybe this opportunity? Is it separate, distinct? Does it help to become a member, or does it have anything at all to do with the DNC?
Great. It's a great question. And I'm glad to see somebody local that I've had the pleasure of working with in the past on the call asking the question. You know, I think there's a lot of sometimes hesitation for folks to get into this space because they feel that they are maybe not an expert. And I think, you know, I was on a call earlier today with a younger faculty member at another children's hospital that had been quite active in incident command during the pandemic at their children's hospital and involved in a number of real world events at that hospital, as well as development of simulations, drills, exercises. But it was pretty obvious that she didn't view herself as somebody that may be able to take on a role that didn't exist at her institution, like the roles that we're talking about through the Disaster Networking Collaborative. And I said, no, you are clearly the exact sort of person that we're talking about when we're talking about people to do this work. You know, I think that there are a number of great opportunities for education and training out there. The courses in Anniston, I've heard very good things from folks that I know that have participated in them. But I don't want people to think that having not done things like that would preclude your involvement in this collaborative. You know, I think that is one of the things that we will definitely talk about through the collaborative is what are the opportunities out there to sort of beef up your own feelings that you have more of an expert lens and knowledge. But I don't think that anyone should think that if they haven't done that sort of work, they'd be excluded from participating in this collaborative.
Excellent, thank you. We also have a question, maybe I'll direct this to either Laura or Julie if she's on. It says, hello and thank you for all the information. Did I see correctly that the webinars will be from 2 p.m. to 3:30 Central Time?
If you're talking about the collaborative sessions, yes. So they are 90 minutes long, which allows enough time for presentation, maybe some sharing from the teams, especially if something exciting has happened or if they had a challenge or a barrier or a question if they wanted to raise, and then the 30 minutes for Q&A, etc. I hope that helps. The webinars are short. The promotional webinar is just an hour, the one in August.
Excellent, thank you. The question next, Johnny, maybe you know the answer to this. Are the sessions from the collaborative, are they going to be recorded for later review, or do you have to be present at the session time to really capture the essence of that work.
I believe they are. Laura, correct me if I'm wrong. Yes?
All sessions will be recorded and posted online for later viewing along with the slides. One caveat, there will not, to our knowledge, be the opportunity to look back at a session and then try to claim nursing credits. So you need to be at the event to claim the nursing credits.
Excellent. Maybe I have, while we're waiting for more questions in the chat, I may have another question for Johnny. And this is me being a little bit of I may know the answer, but I want to hear Johnny respond as well, which is, I hear you say that there's this big funded program called the Pediatric Pandemic Network. Does that mean that the Disaster Networking Collaborative is going to focus on pandemics, or really what is the difference there? What is really the focus?
Yeah, and that's a great question, and it's something that has come up often. The Disaster Networking Collaborative is part of the PPN. Pandemics are part of a disaster. As Brent has alluded to, there are many types of disasters. So I think we don't want to limit ourselves to just one type of disaster. We want to be pan-disaster. That being said, pandemics will be part of that training. The DNC is mostly focusing on infrastructure building and networking. The DRC will have a little bit more probably targeted information towards pandemics, but there will be a little bit, I believe at the one of our last lectures, I believe we'll discuss a little bit more pandemic specific information. Did that answer the question?
It does.
Yeah.
And Laura, what is the deadline for forming our teams for submission to join the DNC?
Oh, that's a wonderful, thanks, Joelle. That's a wonderful question. So when you register, when the team lead from your hospital chooses to register, as long as you have 2 people, you can move forward. There is an option to go back anytime throughout the collaborative to add additional people as you find colleagues within your hospital that are working on or interested in these topics. So, and if somebody leaves jobs, you can remove a person as well.
Excellent. And I know you shared the link to information about the collaborative at the Pediatric Pandemic Network website. The question in the chat asked about the documents that might be available to engage our C-suite that Johnny spoke about. Will that be available there?
Yes, it's on the resource page, and that link is also in the chat feature too, and in the slides. And if anyone has a question, they are welcome to email myself or Julie Shelton, and we will put our email addresses in the chat box as well.
Okay, thank you. As more questions come through, I do want to take some time to highlight and thank our funders and acknowledge their role in making this possible. If we can advance the slide. So once again, the Health Resources and Services Administration are the funders for this program and made all of this possible. And so we're very excited to have their support. I see that there's questions about requesting the time allocation to participate in these educational activities and to build these teams. As Johnny said, a lot of the networking of this is also to learn from each other on how we use strategies at our various institutions to support our work in this space and hopefully empower each other to grow our teams and provide more resources for our teams to be successful. So thank you for sharing those emails, Julie and Laura, in order for folks to reach out to you with any further questions. Brent, Johnny, Laura, anything else that you wanted to add in terms of what the registrations? I will say, speaking from Children's National, I'm proud to say that I heard our team has registered. And while we are a team here in DC that has been all things disaster for quite some time and fairly well resourced, in terms of applying for this, you can be a team who's sort of at the beginning stages of building an emergency management team, as well as one that is fairly far along, correct? Do you plan to have us all meet in the middle when this is being built out? Brent, can you speak to that?
Sure. Yeah. I mean, I think, we're looking for, anyone that's interested in being a participant in the collaborative, any kind of shape and size of existing team or people with different thoughts about the future state and growth of their teams. I mean, I can, I can speak from personal experience that one of the most rewarding parts of my job has been the ability to connect with folks that do similar work at other children's hospitals across the country. And we're really hoping that the Disaster Networking Collaborative serves as a formal way for creation of that network, where people all across the country that may not have met Joelle at a conference or talked to me about something, at another conference, or had the opportunity to meet us and others like us across the country, for those folks to have a gathering place and a way to connect and engage in collaborate.
Laura, I see that you put this slide up. Did you want to say anything else?
Well, you can see the links to get to the Disaster Networking Collaborative website here. It's a drop down under how to get involved within the PPN website. This email comes to Julie or me here, so you can use it. You can email us directly. I did want to mention, Joelle, that we, at the last time we looked, we had 24 children's hospital teams registered in 9 out of the 10 federal regions. Now, I do not know the one region that is missing a team, but Julie might. Julie? You're on mute.
One or 1 minute. Oh, region 1.
Region 1.
Thank you. I love the charades. In a disaster, we're ready for anything. So thank you, Julie, even though your name tag says Laura. On your screen. So I love that we already have participation from a lot of the FEMA regions, the HHS regions. We really want to encourage you also to, those of you that are attending this, if you already have a team at your hospital and could reach out to the partner hospitals in your region, especially, it's that much more of a robust ability to participate when you have your partner children's hospitals who maybe worked with you during the pandemic. And so you can share sort of the challenges and opportunities for your region by being a part of this collaborative as well. So please, for those of us that see people that we work with that are not in attendance, spread the word, forward the information about our website so that we may have as many children's hospitals as possible at the table, just in case another pandemic or other threats come about, so we can all be a part of the solutions together. I want to offer some opportunities for, I see a lot of members attending that are part of the PPN leadership, as well as HRSA leadership. And I want to offer the opportunity for them to add anything that we might have left out that they think would be particularly relevant for the folks attending today. Dr. Macias, I see that you came on camera.
Sorry, I was having a challenge unmuting. No, I think this is a wonderful launch, and we really look forward to being able to collaborate in many different ways. So excited to see the projects that will emerge and the ways that infrastructures will change. And I just want to make the point that the PPN, the ASPER networks, as well as the EMSC Innovation Improvement for Children's Disaster Domain are all here to help and to integrate some of that work. Lots of people to support. So know that we're there.
Excellent. Dr. Newton, as the other PI for the PPN, did you have something you wanted to add as well?
Oh, there it did work. I did get to unmute. No, I just want to say hello. And I think everything's already been said, and as has kind of organically evolved in the chat. Of course, there's lots of different ways to connect both nationally and locally. So the Gulf 7 group, and there's a West Coast group and a Great Lakes group, and with the PDCOE. So connect with the folks in your area, as well as connecting with the national organizations.
Excellent, thank you. So with that, we've presented sort of the core content we hope to share with you today. We're very excited to welcome you to the kickoff of the Disaster Networking Collaborative. Those of us that are part of the DNC leadership and PPN leadership will stay on if there are any further questions, but please be sure to get the CE contact hours with the QR code that's on the slide now. But also feel comfortable dropping off and reach out to us if you have any further questions. Thank you all.
Thank you.